Hello and welcome to Medical Dialogues. I'm Dr. Garima Soni. Here's what I bring to you all from the world of medicine. Sarcopenic obesity, a triple threat for diabetic heart failure patients, study warns. A recent study highlights the potential risks associated with sarcopenic obesity in diabetic patients with heart failure with reduced ejection fraction, suggesting that this condition may contribute to adverse left ventricular remodeling and poor clinical outcomes. This study found that sarcopenic obesity was linked to poorer outcomes in diabetic patients with heart failure with reduced ejection fraction. Patients with sarcopenic obesity exhibited greater left ventricular enlargement, dysfunction, and increased mass along with a threefold higher risk of adverse event compared to those without sarcopenic obesity. These results highlight the importance of targeted interventions to manage this high-risk population effectively. The researchers reported in Cardiovascular Diabetology. Obesity is common among heart failure patients and is a key risk factor for its development. For this purpose, the researchers analyzed 283 patients using cardiac MRI with thoracic skeletal muscle index as a measure of muscle mass. Patients were classified based on median skeletal muscle mass and body mass index, identifying those with obesity and low SMI as having SO. Left ventricular. Left ventricular volume, function, and systolic strain were evaluated, while clinical characteristics and cardiovascular outcomes, including heart failure, readmission, cardiovascular mortality, and heart transplantation, were recorded. The investigation revealed that the patients with sarcopenic obesity had higher levels of amino-terminal pro-B type natriuretic peptides and were more likely to have hyperproteinemia compared to those with obesity but no sarcopenia. Among patients with obesity, those with sarcopenic showed greater left ventricular enlargement, more severe left ventricular dysfunction, and increased left ventricular mass. Over a median follow-up of 35.1 months, 25.8% experienced adverse outcomes, with the worst prognosis observed in the SO group. The findings showed that sarcopenic obesity appears to be a high-risk condition in diabetic patients with heart failure with reduced ejection fraction, contributing to adverse left ventricular remodeling and poor clinical outcomes. Patients with SO exhibited significant structural and functional deterioration of the heart, including greater myocardial dysfunction and a higher likelihood of unfavorable events. Hence, the researchers concluded that these findings highlight the need for increased awareness, closer monitoring, and more targeted medical interventions to improve outcomes in this vulnerable group. That's all for today. Stay tuned to Medical Dialogues for latest updates.
Never miss a medical update from Medical Dialogues. Like, subscribe, and press the bell icon.